Okay, so what brings you in today?
So I'm a teacher at a daycare, and a couple of days ago, I was in the process of breaking up a fight between some of the kids, and I fell and hit my head on a bookshelf. I've been having some symptoms, so I wanted to come in and get checked out.
Okay. Do you have any family history of any neurological or medical conditions?
No, not that I'm aware of.
Okay. And would you say that your work environment is generally a risky environment, or not really?
No, not typically.
Okay. And do you participate in any leisure activities that could put you at a higher risk of injuries?
Mm-mm.
Okay. So I'm just gonna examine a couple of things so that we can kind of get an assessment. So the first one I'm gonna do is the Montreal Cognitive Assessment. And this basically assesses various domains of your cognitive function, and this can just screen for a mild cognitive impairment.
Sounds good.
So, are you ready?
Yes.
Okay. So to begin, I want you to draw a line from going from 1 to A, and then to 2, and then continue on, and then you're going to end here. Okay, and I want you to copy this drawing exactly as you can in the space below. Okay, and then
Oh no. Okay.
in this space, I want you to draw a clock and put in all the numbers and set the time to 10 past 11. Okay, and I want you to tell me the name of this animal.
Lion.
This one?
Rhinoceros.
And this one.
Camel.
Okay. For this next one, this is a memory test. I'm going to tell you a list of words, and you're going to have to remember them now and later on. And when I'm through, tell me as many words as you can remember, and it doesn't matter the order that you tell me them in. Okay. Face, velvet, church, daisy, red.
Repeat them now. Okay. Face, velvet, church, daisy, red.
Okay. So for this next task, I'm going to say some numbers, and when I'm through, I want you to repeat them after me. 2, 1, 8, 5, 4.
2, 1, 8, 5, 4.
And for this next set of numbers, when I'm through them, I want you to repeat them to me in the backwards order. 7, 4, 2.
2, 4, 7.
I'm going to read a sequence of letters. Every time I say the letter A, tap your hand once, and if I say a different letter, do not tap your hand. F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. Okay. I will ask you to count by subtracting from 7. Then keep subtracting subtracting 7 from 100. Then keep subtracting 7 until I tell you to stop.
100, 93, 87, 81, 73, 74, 60.
Okay, stop. Okay. I'm going to read you a sentence. Repeat it after me exactly as I say it. I only know that John is the one to help today.
I only know that John is the one to help today.
I'm going to read you another sentence. Repeat it after me. The cat always hid under the couch when the dogs were in the room.
The cat always hid under the couch when the dogs were in the room.
Okay. Tell me as many words as you can think of that begin with a certain letter of the alphabet that I will tell you in a minute. You can say any kind of word you want, except for proper nouns like Bob or Boston, and numbers or words that begin with the same sound but a different suffix, for example, love, lover, and loving. I will tell you to stop after 1 minute. Are you ready? Now tell me as many words as you can think of that begin with the letter F. Ready, go.
Frantic, face, flap, fly, fix, fang, fruit, football, February, flip, friend, family, fluke, free, fill, flop, for, lying.
All right, stop. Okay. Tell me how a banana and an orange are alike.
They're both fruit.
Okay. Now tell me how a train and a bicycle are alike.
Transportation.
Okay. Now tell me how a ruler and a watch are alike.
They both measure something.
Okay. I read some words to you earlier. I asked you to remember them. Tell me as many of those words as you can remember.
Face, velvet, church, daisy, red.
Okay. And now tell me the date today.
Today is March 5th, 2019.
And tell me the name of this place and what city it's in.
We're at the University of Maryland in College Park, excuse me.
Okay. So now the next, on this exam, everything is scored. So basically, if you get a score of above 26, you're normal, and if not, it may indicate a mild cognitive impairment.
Okay.
So the next thing, I'm going to look at all of your different cranial nerves. We have 12 cranial nerves, in case you didn't know. So the first one is your olfactory nerve, which is your sense of smell. So what I want you to do is close your eyes, and I'm going to hold something up to your one nostril at a time. So can you close one nostril for me?
Mm-hmm.
And I want you to tell me when you can smell something.
I can smell it.
Okay, now do the other side.
I smell it.
Okay. So if you weren't able to smell, that would be anosmia, which means it's a loss of smell, and that could be from could be caused from just a cold or could be from trauma too, and that affects your olfactory tracts. So what I want you to do is hold this chart like about 14 inches from your face, and close one eye, and read the line with the smallest letters that you're able to read.
Okay, V, L, T, D, N, E.
Okay, And now do the other eye.
Same small line, smallest line.
Mm-hmm.
V L T D N E.
Okay. So that. So this is looking at your visual acuity, so which means how well you can see. So if it was normal, perfect, it would be 20/20, and if it was decreased visual acuity, it could mean that you have optic nerve damage, but it doesn't necessarily mean that you have damage. It just means that there's decreased acuity, visual acuity. So what I want you to do is close one eye and look straight ahead, and I'm gonna hold up. You can look at me, and I'm gonna, and I'm gonna hold tight. I'm gonna I want you to tell me how many fingers I'm holding up.
Okay. 3, 4, 1, 2.
Okay. Do the other eye.
1, 2, 3, 4.
Okay. And that if you're able to see in all visual fields, that means that you don't have any visual field cuts, meaning that you can see that there's not a loss of vision in one visual field cut, in one visual field. And if you were to have a visual field cut, that could mean that you have damage to, if you can't see like your right visual field, that means you would have, you could potentially have damage in your left visual cortex because it goes to the opposite side. Or you could have hemianopia, which means like a loss of vision or a lesion beyond or in front of the optic chiasm. So everything looks good. So for the next one, what I want you to do is look straight ahead, and I'm going to just shine a flashlight into your eye, and I'm going to be looking for the direct and consensual constriction of the pupil in response to light. And I should see those constrictions, and if there were abnormal findings, that means that I would not be able to see the pupil constrict, and that could mean that you just could have a pupillary reflex issue. So just look straight ahead. So what I want you to do this time is follow my finger with your eyes, and what we should see is just normal range of motion with your eyes, and if not, then that could mean there's a muscle weakness, so your eyes would be misaligned going from different visual fields. Okay, nice job. Okay, so the next part, just give me a second. Okay, so I am going to touch you on your forehead, your cheek, and your jaw with this pin and the Q-tip, and I just want you to close your eyes and tell me if it feels the same.
Mm-hmm.
Does it feel the same?
Yep.
Okay.
Yeah,
Got that.
feels the same.
Okay. Feel the same? Here? And here?
Mm-hmm.
Okay. Here? Here? And here?
Yep.
Okay. So normal findings would indicate that the feeling would be the same across the forehead, cheek, and jaw, and if not, then you might feel it more uncomfortable or sharper in one area, and that would mean that you could potentially have a sensory processing or issue with the fifth nerve, which is the trigeminal nerve, and that's for the sensory component of the nerve. but then there is the motor component of the nerve, which is for the muscles involved in chewing. So what I want you to do is bite down really hard, and I'm going to feel your temples and your jaw.
Mm-hmm.
Okay. And what I want you to do is open your mouth, and I'm going to try to close it, and don't let me.
Mm-hmm.
Okay, and then do the opposite. So keep your mouth closed, and I'm going to try to open it. Okay. And for this last thing, what I'm going to look for is the jaw jerk reflex. So what I want you to do is open your mouth slightly, and I'm going to put a finger on and then tap my finger. And I shouldn't see any jaw jerk. And if I do, this could mean that there could potentially be a upper motor neuron lesion. Okay, so there was no presence of a jaw jerk reflex, so there's no upper motor neuron lesion. So we're going to look at the muscles of your face. So before we did just the bottom, we just did the sensory feeling, and now we're going to do the motor component of the muscles of your face. So wrinkle your forehead. Okay. Now close your eyes tight. Show your teeth. And pucker your lips. Okay, so normal findings, you would see the normal range of motion, and you would see symmetry. And if there was abnormal findings, you would see potentially see asymmetry, and that could potentially mean that there's problems with the motor component of the facial nerve. So I'm going to put something on your tongue, and as you stick it out, and I want you to tell me if it's sweet, salty, bitter, or sour. And close your eyes and stick out your tongue.
Salty.
Okay. And this, obviously, if you were unable to detect the taste, this could mean that potentially there's a sensory deficit with the sensory component of this facial nerve. So the next part is the 8th cranial nerve, which has to do with hearing and balance. So what I want you to do is close both of your eyes, and I want you to tell me if you hear the sound and in which ear.
In my right
ear. Okay. And this time I want you to keep your eyes closed, and then I want you to tell me, do you hear it or do you feel the sound better on one side versus the other?
I hear it. Maybe on the right.
Okay. And so if that was with the tuning fork, that was our bone conduction. So if bone conduction was greater than air conduction, which was the first one, then that could mean there's potentially a conductive hearing loss. So for the last one, I want you to look straight ahead, and don't move your eyes. I want you to stare straight ahead, and I'm going to turn your head and keep fixating on the object straight ahead. Okay, so if you were unable to focus on the object ahead, and you complained of being dizzy, that could mean that there's potential brainstem dysfunction, or normal findings would just be that you were able to just keep your focus. So this time, what I want you to do is look for, what I'm going to do is have you open your mouth, and I want you to say, ah, and as, okay, so say ah. Can you open your mouth a little bit bigger? Okay? And so I should, in looking into your mouth, I should be able to see that your, the one side, I should be able to see your palate rising when you say that. And if there was unilateral weakness, it could deviate to, it would deviate to one side when it would be the normal side. But, and if there was bilateral weakness, then it wouldn't rise at all, and you would just have a lot of air coming through your nose. So, I'm gonna this next part is eliciting the gag reflex. So, normal findings would be that you would you would have the gag reflex when the tongue depressor is pressed on your tongue.
Mm-hmm.
And absence of a gag reflex could mean that that again the palate would not rise. Much same. So please stick out your tongue, and I'm going to touch the back of your throat. Okay. So the gag reflex is present. All right, so this time what I want you to do is we're gonna look at the accessory nerve. So I want you to shrug your shoulders, but I'm gonna try to put some resistance, and then we're gonna try to turn your head, and you're gonna provide, and I'm gonna provide resistance, and you're gonna do it against my resistance. Okay, so shrug your shoulders. Okay, and then I want you to turn your head to your left. Okay, and now turn your head to the right. Okay. So if normal findings, you'd be able to do that against resistance, and if not, then that could mean there could be a lower motor neuron lesion, and you're looking for a deficit in the muscles of the nerve. So for the last one, what I want you to do is stick your tongue out and move it side to side. Okay? And so normal findings would be able to do that, and if not, your tongue could be have like fasciculations where it could just be spontaneously moving without you doing anything, or it could have atrophy and or it could be deviating to one side, and it would be the weak side. Okay, so for this next part, what I want you to say is pataka, this repeatedly, and this is called diadokinesis and diadochokinesis, and it looks for if there's any cerebellar dysfunction. So when you're ready.
Okay. Pataka, 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 pataka.
Okay. And so also the inability to be able to rapidly alternate the movements could mean that there's a lower motor neuron lesion potentially. So I'm going to, I want you to move your pointer finger from your nose to my finger, and I'm going to be moving my finger to different positions. Okay. So if you, normal findings would mean that you were able to stretch your arm out as far as possible. And if not, then that could mean that there could be an ataxia, or there could be like a decreased or an increase in movements. So for this last one, I'm going to look at your arm. So give me your right arm. Okay. And I'm going to be looking at your arms to see if there's any bulk or fasciculations, which is kind of what we looked at for your tongue. Okay, so now what I want you to do is we're going to flex your arm. We're flexing your arm, and then, okay, and then extend, just relax. Okay, so if normal findings would be that you were able to flex and extend, and if you weren't, that could mean that there's decreased tone, which would mean that there could be a lower motor neuron lesion, or increased tone, which would mean an upper motor neuron lesion. So now what I want you to do is flex your arm. Do it again. So I'm going to try to push your arm into extension. Okay, and then we're going to do the same thing on your left arm. Okay. So same thing, that this is looking at strength, and this looks at fine motor movements. So your distal extremity weakness has to be worse than the proximal weakness. Okay, so for this last one, what I want you to do is close your eyes, and I want you to tell me if the object feels sharp or dull, and you can feel them. You can open your eyes if you want. You can feel them, and I want you to tell me if they're sharp or dull.
And then I close my eyes.
Mhm. Okay. Okay, you can put out your arm.
That feels dull, and the other one feels sharp.
Okay.
That one's sharp.
Is the sensation pretty consistent?
Yes.
Okay. So again, if they felt different, at normal findings would be that it's pretty consistent across each time, and if it was abnormal, then it would feel more uncomfortable in different areas. So close your eyes again, and I'm going to take your thumb. Give me your right thumb first, and I want you to tell me if your thumb is up or down.
Down.
Okay, and let's do it on the other one.
It's up.
Okay, so normal findings, you'll be able to detect if the position of your thumb. You could also do it on your toe, and if you were unable to detect if it was up or down, that could mean that you have some proprioceptive loss and could be affected by some kind of lesion in your spinal cord. So again, close your eyes, and I am going to place an object in your hand, and you'll need to tell me what it is.
Pen.
Okay, and now give me the other hand.
Q-tip.
Okay, you can open your eyes. So normal findings that you can identify the objects in your hand, and if you weren't, it would be called a stereogenesis, which means that you could have a lesion of your left parietal lobe. All right, so for the last time, close your eyes, and I'm going to write a number or a letter on your hand, and I will need you to identify it.
3.
Okay, and the other one?
13.
Okay, so this would be normal findings, be able to accurately identify the letter or the number, and this could also mean, if you had abnormal findings, that you could have a lesion of your left somatosensory cortex, or just your somatosensory cortex.